Hi, I'm Paula Davis, your Chief Communications Officer and Executive Sponsor of the LGBTQ plus and Ally Employee Resource Group. And I am excited to be here today for this incredible conversation that we're going to be having for World AIDS Day. Today is World AIDS Day. And as part of our purpose of reimagining a healthier future for all people, their pets, and our planet, we wanted to bring you this conversation, which is very, very important. You may not know this, but HIV/AIDS affects all of us in some ways. Even today, 38 million people are impacted. And you may be surprised to know how many different people it impacts. Every week, approximately 5,000 young women aged 15 to 24 years become infected with HIV. About 48% of the estimated 1.7 million new HIV infections in adults globally were among women and girls in 2019. And in the US, the CDC reports Black and African American people accounted for 42% of all new HIV diagnoses in 2019. So it's many communities who are impacted by HIV/AIDS. So what can we do to help safeguard our healthy futures? We're here today with Dr. David Resnick and Dr. Maria Ryan, our Dr. Maria Ryan, two oral health experts who have experience treating people with HIV/AIDS. And they're going to teach us about the importance of oral health and its links to our physical health and also our mental well-being. So we're going to ask you to know your OQ, your oral health quotient, and the links of oral health to physical health and mental health. And it starts with knowing more. So without further ado, I'm going to turn it over to Dr. Maria Ryan to take us through this amazing interview that we have here. Thanks for joining. Maria?
Thank you, Paula. My name is Dr. Maria Ryan, as Paula said, and I'm the Chief Clinical Officer at the Colgate-Palmolive Company. And I'm really excited to be here today with Paula and with Dr. Reznick for World AIDS Day to talk about the connections between oral and overall health, particularly with regards to people with HIV and AIDS. I can recall when I was a dental student, we never wore masks or gloves, eye shields, and it really was the AIDS epidemic that changed the way that we practiced so that we could help people who were suffering with this disease. And Dr. Reznick will talk a great deal about his work as a pioneer in this space, really helping to treat people who needed our help. Also, I am a practicing periodontist, and it's really, really important to understand the impact of oral health on overall health, and particularly in people with HIV and AIDS. And as Paula said, unfortunately, many people do not know their OQ or their oral health quotient, which is about, these connections between oral and overall health. And so we have started a campaign to help people to understand the importance of oral health, to understand the major diseases that we treat, which are caries and periodontal diseases. And there are others that can affect people who are immunocompromised, which Dr. Reznick may talk a little bit about in his discussion with us, and also how to seek help, how to get the help of an oral health professional, because it is very important that you see people who can help you to resolve the oral issues and maintain great oral health and overall health. So I'm going to ask Dr. Reznick to introduce himself at this point.
Well, thank you, Dr. Ryan. I'm Dr. David Resnick. I am Chief of the Dental Service at Grady Memorial Hospital of the Grady Health System in Atlanta, Georgia. And I founded the Oral Health Center, which is a component of our Ponce de Leon or infectious disease program over 30 years ago. We're the most comprehensive outpatient program for people with HIV and AIDS in the US. We offer all services under one roof. And it's a pleasure to be with you here today to discuss some of the issues that we've seen in the past and what we're seeing in today's present.
Thank you, Dr. Reznick. I really enjoyed speaking with you the other day about your journey and hearing a little bit about the story of how you came to serve people with HIV AIDS and how it started with some advice from your brother. So maybe you could share that story with all of our listeners.
Yes, I actually warned my brother last night that I would be talking about him today. When I graduated dental school back in the no glove days and no face shield days, there were a lot of dentists in Atlanta. And my brother, who is 10 years older and skipped first grade and was already a successful dentist, said that you just can't hang a shingle anymore, that you had to target an audience. Well, I came out in dental school, so it made the most sense to me to target the LGBTQ community at that point. And that's what got me started in HIV care, because that's basically when I started my practice, which is when HIV hit Atlanta. So it was almost a mutual kind of event. So he told me to look at that targeting. I did. I advertised in some of the local magazines. My practice was thriving. And then one day I got a phone call, or the office got a phone call, and my mom was our front desk. And she did the entertainment there, and I did the entertainment in the back. And she said, "David, you need to take this call," that the patient was very angry and very threatening. And I did take the call, and the patient was exactly what you listen to your mother. So you listen to your mom, and she was right, what the patient stated. And so I actually scheduled him for the last patient of the day the next day. And the reasoning was he had had his teeth cleaned every 6 months since he could remember, but upon learning his diagnosis, no one would treat him. So it was new. I did not learn a thing about HIV in dental school. I thought it was something that happened to people in New York and in San Francisco and LA, but yeah, we're a little slower in the South. It wasn't here. But that's really what changed my trajectory. That one patient who was one of the nicest people I have ever met, who was put into that position because of denying a form of discrimination based on a health condition, which was not something that worked for me. My mom was a Holocaust survivor. And therefore, we were taught that prejudice is just not something that is okay. So word got out that I would treat the patient population. And before I knew it, around 1988, half of my patients were actually free. I got a phone call from AIDS Atlanta one day, and their CEO, and she happened to be President Clinton's AIDS czar later on. And she asked if I would take patients on a sliding fee schedule. And I said, yes. My mom didn't know how to do it. I didn't know how to do it. So we did it for free. And we didn't really tell my brother right away. And then Grady called up asking me the same question a few months later. So before I knew it, half of my patients were really very ill. And the other half of my patients were really very wealthy. It was a really interesting dynamic in the waiting room, and everyone got along. It was perfectly fine. I did get worried when that David Aker case broke that I would lose my paying patients, but none of that actually happened. So I went on a 5-year mission to start a program without a public health degree, just based on passion and persistence, and the one P I'll always be working on, which is patience. So,
oh, that's fabulous. So important, the work that you did for so many who I know personally from my experience as well, were seeking help and were coming to dental offices and being turned away at that point by many because of fear. And fortunately, there were people like you who were able to manage them. And fortunately for us as a profession, we really turned that around very quickly, and were able to help to better manage what was an emerging epidemic at that time. And so, at Colgate, we really, really believe in the power of partnerships. And, through partnerships, I think we can achieve so much. And you've talked just briefly about some of your partnerships with various organizations, but you've also had a partnership with Colgate. And I'd love for you to share with our viewers a little bit about that partnership.
it was really an amazing time. We were really busy, and there was this wonderful person from Colgate Oral Pharmaceuticals, Shirley Youngs. I called her Shirley the Colgate lady. And I think, the first place that she stopped when she got this job, and we became friends, and she knew what the mission was. So she started stocking supplies that she would be handing out to other dental offices and saving them for my patients. So we would go into her trunk and do a shop-a-thon, basically. Through Shirley, I met her supervisor and Jerry Smith, and then up to John Bohr, and they thought it might be a good idea for Colgate-Palmolive to form an oral AIDS task force. So Shirley and I got on a plane from Atlanta, went to New York, suffered through all those little crazy yellow cabs, because we both thought we were going to lose our lives in those little yellow cabs. Had a fabulous meeting with Dr. Chris Fox and Dr. Marsha Butler. And what ended up becoming the Oral AIDS Task Force became HIV Dent, or HIV Dental Alliance. And that is now 24 and a half years old. We've been on the internet. We've helped people get access to care. We've done training in many parts of the world, not just in the US. It's been a true blessing and an incredible partnership. And it all started because of that one truly fabulous Colgate lady, Shirley, and then the people on her team. It was really remarkable.
Yeah, it's our team, our scientific affairs teams, and those that go into the dental practices and the academic managers have been such an important part of this company, and their interaction with you clearly led to very significant change. And Doctors Fox and Butler were always great advocates for oral health for everyone, access to everyone. And so you mentioned briefly HIV.dent.org, which is basically a professional site, but I think also can be very helpful to anybody who wants to learn more about HIV, AIDS, and oral health. Do you want to elaborate just a little bit on the site?
Sure. HIVdent.org, which is really a nonprofit now, the HIV Dental Alliance. It started out as a way to export the lessons learned here at Grady's infectious disease program. It took me 5 years to get a program started. I wanted to create shortcuts for people and also to get the proper information. So literally what we have is I exported the building. So yes, you have dental treatment issues, you have infection control, you have the picture gallery, which to this day is still the most popular. People like seeing all the oral lesions, but also medical information, mental health information, medication information, US policy, international policy, ending the HIV epidemic. We try prevention, which is very important, getting across messages such as you equals you, that if you're undetectable, you cannot sexually transmit the virus. So there's information on there for professionals, but there's also information on there for consumers of care. And it's always been that partnership and their input which makes us grow.
That's fabulous. And having a resource like that available to everyone is so important. So let's talk a little bit about the connections that we see and the clinical markers for HIV/AIDS that might help a dentist to identify the disease in someone who may not know, because unfortunately there are many people who may have HIV but are not aware of it. And the earlier we know now, the earlier you know, the better, right? To help reduce the viral load. So what are some of the clinical markers that can help people to determine if perhaps someone might be infected?
So it's a great question. One point is that there are no oral manifestations that are diagnostic of HIV, meaning that they show up in other conditions. The most common oral manifestation that we see is pseudomembranous candidiasis or thrush. So if a patient presents with candidiasis and they're not on a steroid inhaler, they don't have diabetes or unaware of that, you can do screening in dental offices. That's one of the things I first set up and did technical assistance around the country on, or you can refer. But it's important. One of the other things is that these now, for patients who are in care, these oral markers can show that a patient is failing therapy or has fallen out of care. a person who has undetectable viral load and a CD4 count of 200 or above should not present with a pseudomembranous candidiasis or erythematous candidiasis or even oral hairy leukoplakia. All of these are diagnostics, or at least lead us into that direction. But if they're taking their meds and staying in care, they shouldn't present. So one of the best things that we can do is help link people into care, help maintain people in the care. That's how we're actually going to get this epidemic under control, is to make sure our preventive messages and medications are available, especially to those most in need, to make sure that people stay in care. And we have people here at this program. We followed 6,000 people with HIV in the infectious disease program. About 2,000 come to oral health. And we have the highest level of engagement of people staying in medical care, and the highest level of undetectable for all the different clinics that are here. But talking about that mental health component, in the earlier parts of this pandemic, I would literally sometimes have a patient in the chair for 45 minutes and never touch an instrument. They just wanted someone to talk to. So we really need to get over the stigma that is still driving this disease.
Yeah, absolutely, absolutely. And now with the medications available, people are living long lives with HIV and keeping those viral loads down. So it's very, very important. It's a chronic disease that people can live with based on the progress that we've made. So we recognize that there are certain oral conditions that people with HIV may have. And what is the impact of not treating that on their overall health and well-being?
Oh, you're a periodontist, so you're very well aware of some of the periodontal manifestations that we see. Something as severe as necrotizing ulcerative periodontitis, where the person is in excruciating pain, they have an underlying systemic illness and they can't eat, or to having rapidly advancing periodontal disease because they haven't been in care. And so in our program, we put a lot of our emphasis on prevention, because our greatest thing that we have is time. And so we don't have that much time. We can't be redoing work. So having our patients on Preventive 5000 products at night, using the PerioGuard during the day to help address some of the oral manifestations that we see on a periodontal front are really important. And we don't want to make a partial for somebody and then 3 years later have to turn that into a denture, or spend time doing endo and crowns or whatever we need to do. But we do know that there is an impact on the mouth, that you cannot be healthy without oral health, that if you don't treat something like a candidiasis, it could turn into something like esophageal candidiasis. So taking pills becomes difficult, eating becomes difficult. There are so many things, some really awful things that I've seen in the last 30 years that I'm very grateful to say I very seldom see today. People who had a hard palate necrose out from necrotizing ulcerative periodontitis because no one knew what to do. I was blessed. That was before the internet, before cell phones. I picked up the phone and called John Greenspan, a well-known researcher, and he called me back with answers on how to address necrotizing ulcerative periodontitis. So another reason we created HIV Dent was so people could contact me and other members of the faculty, and we could answer questions, so there would be resource available. So there were no more of this unknown that I was facing way back before in the 80s. So we really waited for the internet to become available for our presence to be there. So the idea was actually created in 95. We didn't go live until 97, when we thought the internet would be developed enough at that point to manage what we were trying to do. We've even created an oral app now for HIV oral diseases that you can look at, and you can look at pictures and treatment. It's been a remarkable experience and would not have happened without the incredible support I've received.
Well, that's fabulous. And I know that, from the work that I've done over the years, looking at the impact of periodontitis on your ability to control diabetes, on your risk for cardiovascular disease, on your risk for respiratory diseases, It's all important for people with HIV/AIDS because they deal with these same conditions as well, and may even be more susceptible to many of them. So it's very important to manage oral diseases, particularly periodontal disease.
Because of inflammation. Inflammation is one of the things that is driving the impact of this disease. It's one of the reasons we think we're seeing aging happening a little faster in some of our patients who've lived a long time with HIV and been on medications for a long time. So you really need to get that inflammation down, and the best way to do it is good oral hygiene and being able to be seen by dentists, dental hygienists, dental team to address these concerns.
Fabulous. So we're coming to the end now. So we just want 3 quick things that you think a person with HIV/AIDS should know about their oral health, something that they can take home with them and act on based on our conversation.
So 1, do oral exams, look in your mouth, see if there's anything that's different that might be there, if you feel something of that sort. 2, keep your appointments with the dental office, whether it's hygiene on routine basis or getting your work accomplished. And then 3, I think one of the big things is know the right information. You can't be turned away based on HIV status alone in the United States. That CD4 count is not a limiting factor on the ability to provide comprehensive care. And that viral load, HIV viral load, is not a limiting factor. So, but know your status, know what your meds are. And if you have problems when you go see the dental office, make sure you write them down. It might be more than just a toothache. What are your concerns? Are you having difficulty eating? You can't take these medications and not have proper nutrition. So that's a whole another part of this component. So I think the whole thing is that you can't be healthy without oral health. And that's where the beginnings of this start. We really must do our part as a part of the primary healthcare team.
Thank you so much, Dr. Resnick. This has been so informative, and I'm just really excited to be here with you for World AIDS Day. And I would tell all of our listeners, clearly your oral health is really important to your overall health, and you do need to know your OQ. So I would send you to our Colgate-Palmolive.com website, and you can find the Know Your OQ section, and you can see how much you actually do know about your oral health and learn more about the importance of your oral health to your overall health and well-being. And I would say for any practitioners that are listening in, please go to Dr. Resnick's HIVdent.org site to learn more about managing people with HIV/AIDS and the importance of their oral health. And Dr. Reznick, please keep up the great work.
Thank
and
you.
we look forward to our continued partnership between you and Colgate. Thanks
Thank
again.
you. Thank you so much. It's been a remarkable, long-lasting partnership. So thank you.
Thank you.